Okay. I am audible?
Yes, sir. Yes, sir.
Okay, very nice.
Yes.
Now only 40 students joined so far. How is the experience in online classes, sir? Mahesh Garu?
Good, sir. Okay. Not good as offline, but okay, sir.
Okay. Today, in our psychopathology class, our topics are related to block 3. Everybody is audible, sir? Andaru vintunarandi?
Yeah, it's audible, sir. We are on
Yes,
mute.
sir. Yes, sir.
Yes, sir.
Very nice. Today, block 3. The block 3 is having totally 5 units. Today we will discuss the first 2 units, unit number 10 and 11. Unit number 10 is Introduction to Developmental Disorders. And unit number 11 is Cardiovascular Disorders. These 2 units we are going to discuss. First, our topic, developmental disorders. What is meant by developmental disorders? During person development, these disorders will influence the person functioning, behavior, intellectual. All 3 areas will get affected. So these are all called disorders. In these development disorders, your book is having only 2. First one is autism. Second one is intellectual disability or mental retardation. These 2 topics only in your book. It is there, but number of development disorders are there. So first let us discuss about what is autism. Autism is a cluster of conditions will appear in early childhood. Early childhood means before 3 or 4 years. Till that time, most of the parents will get confused. Why my child is looking like this? Why my child is not interacting properly? Why he is not looking when I calling? These type of confusions parents will have. So once, if somebody advised or on their own, if they took their child to a pediatrician or a psychologist, they will assess by seeing his conditions, by observing his behavioral aspects, they will come to a conclusion. This child may have autism symptoms. Autism is a spectrum. Under autism condition, there are 5 conditions, different symptoms each condition will have. But in your book, they have not elaborated what are the 5 different conditions also. Actually, normally this autism affected children's, they don't relate to others. They don't see others. They live in their own world only. They live in their own world. They are not like other children. They don't give even eye contact when parents calling or somebody calling. They don't give even eye contact also. Why these autistic symptoms coming? So far, there is no clear-cut reasons. Medically also not find. Only people are doctors or researchers only assuming some of the conditions affecting children with autism symptoms. Suppose parents are emotionally cold or intellectually distant. Emotionally cold means when a child is crying, parent is not taking much care, or our children's needs are not attended immediately by parents. That means parents are emotionally cold. In that condition, children will be neglected. Some researchers, some experts, they are saying in early childhood, the children's neglecting by parents also, it will cause autistic symptoms. It is only one of the suspicion, not proved also. Autistic children can be extremely sensitive to change. They don't accept any change. Suppose they are eating in one plate daily. If parents change another plate, they don't accept, they don't eat. They want always sameness. If the child is playing, so many toys children will have. But he will play most of the time. If parents changes the toy, he will not agree, he will cry, he will ask for the same toy. And autistic children will exhibit repetitive behaviors, some restrictive behaviors. And socially, they are very inactive. And communication-wise also, they will have problems. This type of conditions, in our assessment, the pediatrician or a psychologist or therapist, somebody observe, they will come to a conclusion, this child is having autistic symptoms. Generally, if autism identified in early age, the prognosis, that means the improvement will be somewhat better when compared to autism identified in later ages. Nowadays, the more awareness got parents, they are taking their children to pediatrician or psychologist for assessment at the age of 18 months only. But society is having a lot of unawareness about autistic symptoms. If parents or grandparents, by observing their children, what they are feeling, my parents were delayed like this. And even my grandfathers got speech very lately. So because of this hereditary effects, my kid also delay in speech and communication problems and behavioral issues. After some age, that means when his age increases, he will become normal. Like that, even today, many people are having this type of myth. But this is not correct. So parents has to get awareness. Their child must be screening in early age. That means from 18 months to at least 24 months between, their child must be screened by a professional. If they have any doubt, If otherwise child is behaving normally, his functions are normal, they need not worry. If they got any doubt, they can took him to for screening purpose. Okay, sir. All are following?
Yes, sir.
Yes, sir.
But sir, if a child is diagnosed with an hyperactivity.
Hello?
Hello, sir.
Please.
Am I audible, sir?
Please.
If a child is detected with a hyperactivity, he is very hyper. So people does that child fall in this statement, sir?
Okay. Autistic children will have different conditions. I told you there are 5 varieties under one spectrum. Some children will have even speech problem also. Some children will have behavioral issues. And ADHD type symptoms also some children will exhibit. But all these symptoms will be diagnosed. These symptoms related to which type of autism in early screening. So screening is very important when parents got any doubt. Okay, clear?
Yes, sir, but few parents, they are very much adamant to accept the fact, since I am in a pre-primary school, so to accept the fact that a child has some.
Okay, I am agreeing. Some parents, they don't agree about their children, their condition. They feel my child is very good. Why unnecessarily others are complaining about my son? But ultimately sufferers who parents only in lateral age. So we have to, when they come to us, we have to educate them. See, screening the children is not a wrong thing, na? Early identification always help them. So as a psychologist, as a counselor, please advise who are coming to you. If they got any doubt, let them screen it. Okay? Is it okay?
Yes.
Somebody can react.
Yes, sir.
Okay, sir. Yes, sir.
Okay, please respond, sir.
Okay, sir.
Yes, sir. Yes, I understood.
Okay. Generally, the symptoms for autism, how to identify autism. First, the child comes to you. Normally, they don't give any eye contact. When you call her name or his name, he don't see our faces. Number of times calling also, they don't see our face at least. He is playing on his own world. He is looking somewhere. Even in front of him, somebody moving also, he don't observe. He don't bother who is coming, who is going. He is in his own world only. So that is one of the condition of autistic children. Symptoms for autism. They lack social interaction. That means they don't play with other children. They are in isolate mode only. They are most of the time they are alone. Whatever they like, they likes the toys, they will play only. And these autistic children's another second symptom is sensory issues. Autistic children will have sensory issues. Sensory issues means, suppose there are 2 types sensory issues also. One is hyposensory, another one is hypersensory. Hyposensory means even very big sounds also, they don't react. They don't respond. Hypersensory, the affected children, for small sounds also, they will close their ears. So there are 2 types, hyposensory and hypersensory. Not only hearing and vision also it will affect. Flashlights and very high focus lights, they cannot tolerate. So these 2, light, these 2 areas, somebody please unmute.
కనపడాలి వీడియో ఆఫ్ చేసాను
ఆడియో కూడా ఆఫ్ చేయగలరా ప్లీజ్? గెలాక్సీ ఫోన్ యూజ్ చేసేవాళ్ళు ప్లీజ్ ఆఫ్ ద ఆడియో.
Okay. So far we discussed symptoms of autism. Once they have social interaction problems with other children and other people, they will be on their own world only. And sensory issues in audio and vision. In both areas, they will have sensory issues also. Some children will respond very highly for small sounds. Some children, they don't respond at all for even for bigger sounds. And they have communication issues. They don't communicate to the outside world what is happening. They don't receive the information also. And they don't give information to outside world also. So this type of communication issues also affects this autistic children. And they sometimes, some children, they exhibit repetitive behaviors. They will move their hands, fingers very repeatedly in front of the eyes or spinning their hands like this constantly. These are all the physical issues and behavioral issues they will exhibit. And they are very not sensitive to pain. Even children, for small pain also, they will inform to parents and they will cry sometimes. But these autistic people, they have pain sensitivity is less for them. The threshold for pain is very high for them. Like this, and when they come to a screening purpose, there is a very big screening tests are there, autism screening test. Through that test, we can find out the children is coming under which type of autism. There are 5 types of autism are there. So the child is falling in which type of autism. And after identifying their condition, they will talk to the parents. Your child is suffering with this autism. So he needs some intervention, therapy. It takes very long days. Even autism therapy takes very long days. Long days means not only days, it takes months and sometimes years also. Autism is a very pervasive developmental disorder, neurodevelopmental disorder, and intervention takes according to their condition. If the child condition is mild stage, it won't take years. It will take only months. If the child condition is moderate or severe, it may take even years also. And if the parents identified the child condition in very early age, that means 18 months to 24 months, the child recovery will be somewhat faster comparatively the children's identified at later ages. Okay, clear?
Sir, I have one question.
Please.
Sir, what could be the causes of this disorder? Can you please just, if you, I mean, I did not join in the beginning. So if you have not covered, can you just share a few points? Like what could be the cause of this autistic, and is it only in children?
Yes, it can be identified at childhood. If they don't treat properly, if they don't provide any intervention, it may lead to for elder people also. And identification is very, very important in early age.
Yes.
And The reasons you are asking why autism is prevailing in society now very seriously. So far, there is no identifiable cause. This is only the cause. Children are getting affected with autism. So far, not identified particular cause. People are saying, some people environmental causes. Some people are saying genetical causes. Some people are saying radiation. Like that. There is no pakka, this is only the cause. So far, nothing was identified.
Right. And this is a latest development. So like, nowadays we are coming to see across a lot of children affected, and especially during the Corona times, the children are going to school. I see that, ratio is like 6 out of 10 children are affected with this autistic behavior.
Yes. Now, in Indian conditions, officially, for every 50 children born, for every 50 children's birth, one child is getting affected with autism. That is the recent statistics. Understand the severity, how much is there. Even in Hyderabad city, there are a lot of therapy centers for autism. But how many people are giving proper therapy? Nobody is monitoring also. Because of parental anxiety, stress, they are bringing to people. Whether they are bringing to correct person or not also, they don't understand. That is the prevalence of autism in India today. For every 50 kids, one kid is having autism symptoms. So only the solution is early identification, early intervention. These two only, some conditions will get improved in their later ages. 100% cure, no guarantee. Some improvement will come. So that means, some improvement means in their daily functioning in lateral ages, it can be improved up to some extent. Okay, clear?
Yes. Thank you, sir. Thank you.
Sir, I do have a question.
Sir.
During the pregnancy time, if a woman takes excess medicine due to another condition, does that also be one of the cause for the autism?
Maybe. See, the prenatal precautions mother taking, also some of the causes people are saying.
But
okay.
She has to survive now, sir, to deliver the baby. So she has to take care of the medicines. If that could be the reason, again, any woman will be very sensitive in this kind of patient. So how to eliminate the fear of the taking medications in this?
See, nowadays, our lifestyles have changed a lot. We can't escape certain lifestyles nowadays. We cannot avoid. Being a pregnant woman, she is forced to live in that conditions only. She cannot avoid certain conditions. See, can we avoid pollution today? Can we avoid radiation?
Yes, sir.
Can we avoid the food habits what we are having today?
This can be said.
Most of the people are eating today outside food by getting through Swiggy or Zomato. How they are preparing food, what things they are mixing in that, we don't know. Which one is affecting, we can't say. That is the reason I am saying nothing was identified so far. This is only the correct reason is causing autism. Okay.
But it is definitely not the genetical.
Genetics is one of the reason.
One of the reason, okay.
Not definitely. Genetics is one of the reason.
But that should be that somebody in the family should be already having it. Genetical disorder. Again.
Yes, already in their family, somebody affected with autism, there is a chance.
There is it. Otherwise, no, nothing.
There is a chance.
Oh.
Okay. In this developmental disorders, the first topic is autism. Because our time is only 1.5 hours, we have to discuss totally 5 topics today in 2 chapters. And coming to mental retardation. Mental retardation means the intellectual functioning, that means the reduced, the lower level intellectual functioning. It will be called mental retardation in olden days. But now this was changed to intellectual disability, intellectually challenged children. We are calling only these 2 words, intellectually challenged or intellectually disabled. In olden days, in earlier days, the terminology is mental retardation. But we are not supposed to use now mental retardation. We are using only intellectually challenged children, intellectually disabled children. So, why this intellectual disability is happening? Here, there are many known causes and there are many unknown causes also. The intellectually disabled, how to identify whether he is having proper intellectuality or not? Suppose in schools, if the child is not up to the performance mark, most of the parents identifying their son or daughter having some disability in intellectual, only at school level only most of the people are getting identified. By that time, the child is getting at almost 7-8 years. It is also delay. So, for early screening, how their child is getting developed. Developed in the sense is physically, socially, emotionally. When we observe, we can identify even mental retardation also, mental disability also, intellectual disability also, we can identify in early age. Here the problem is unawareness. And the families, some families, what they are having myth. For everything, early screening is very, very important. Then only the prognosis will be better. Okay. Intellectual disability, how to identify? Only through measuring his intellectual abilities and his functioning areas. Not only by conducting a IQ test, we cannot say this person is intellectually disabled. And we have to observe his functioning also. How he is functioning in day-to-day activities. In day-to-day social activities, how he is functioning. Both the things, IQ test and his social functioning and daily functioning, both these things will decide the person's intellectual ability. Normally, average person, average functioning person will have IQ levels of 90 to 110. 90 to 110 IQ levels is a normal functioning person are having. If any child in their assessment, in their screening, getting less than these IQ levels, they will be classified different levels of intellectual disabilities. That levels in your textbook also, in page number 101, they given very clearly the types of intellectual disability conditions. Please look in your books, page number 101. Mild mental retardation.
Yes, sir. it is
IQ
good.
level 50 to 70. Moderate mental retardation, 35 to 49. Severe mental retardation, 20 to 34. Profound mental retardation, below 20. Normally, the severe people and profound people, they cannot function on their own. Lifelong, they are dependents. Their conditions, improving chance is very, very less. Only in mild conditions and moderate conditions, people can be improved to their daily functioning without any much problems. Here, the mild condition is very much can be improved. So these are all the IQ levels decided by DSM-5 criteria. There is an international standard DSM-5 and ICD-11. These two things decided the intellectual disability and classified in 4 groups: mild, moderate, severe, and profound. But there is one more class between 71 to 90. They are in borderline. There is very high chances the borderline people can be brought to very normal people. I will say one example. By birth, they are intellectually, they don't have much problem. Because of their social conditions, made them somewhat inferior in IQ levels. Suppose the children are growing in rural area, they don't have much access for skills learning. Those children will exhibit somewhat less IQ in their testing. That means they are not low IQ people. They are not having chance to learn skills. That is the reason their IQ test is showing somewhat lesser IQ. For those children, we have to create opportunities, particularly parents has to create opportunities to learn more social activities, more skills. Then their intellectual functioning will become very normal. And coming to why mental retardation, that means intellectually the disability is occurring to the kids. What are the reasons? There are some genetical causes. Genetical causes means the causes coming from parental heredity. Those are all called genetical causes. What are the genetical causes? In your textbook, they mentioned some causes. One is Down syndrome, Fragile X syndrome, and phenylketonuria, that means PKU, Tay-Sachs disease. These 4 conditions they identified in genetic factors. Out of this, Down syndrome. See, all humans are having in their body neurons. Neurons means cells. Every cell is having 46 chromosomes. That means 23 pairs of chromosomes every cell is having. In their cells, the 21st chromosome, because of some reasons, it will get 3 cells, 3 chromosomes in particular 21 cell. the total chromosomes will become 47. That condition will create a Down syndrome baby. Down syndrome babies, just by seeing, we can identify easily this child is having Down syndrome condition. But Down syndrome conditions are intellectually much disabled. They fall in mild or sometimes even moderate conditions also. By the time their birth has happened, but this Down syndrome, how to prevent? During pregnancy time, a couples can approach a genetical counselor, or they can go for genetical testing also. It can be identified. They will test the chromosomal condition in the newborn baby. If they identify in the testing, this baby is having Down syndrome symptoms, the chromosomal abnormality the baby is having means, so the couples can take a decision whether to continue this pregnancy or not. That is also up to some months only, not in advanced stage. In early stage only, it is possible. In Hyderabad also, there are so many genetical testing centers, genetical counseling centers also available. So as a psychologist, as a counselor, I request everybody, educate the people about Down syndrome. It causes genetically. There are more chances those women are having more age during their pregnancy. That means above 35 years will create more chances of getting a Down child baby. If the age advances to 40, that time conceiving means there are further more chances getting Down syndrome babies. So here age also will play a major role in Down syndrome conditions. Okay, sir. Audible? Vinipistundandi?
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Yes, sir. Yes, sir.
Next genetical condition is Fragile X syndrome. What is this Fragile X syndrome? We are having 23 pairs of chromosomes. In any one pair, particularly the X chromosome, tapered off, something, the chromosome, the part, some of the part was teared off. That means it got fragile. It is a fragile item. Something got damaged. Something got teared off in X chromosome. So in that condition, the children will develop mental retardation. Intellectually, they will become disabled, very severe. And this condition also can be identified. This condition also can be identified. But there is no treatment for this. Try to understand, there is no treatment for Down syndrome and Fragile X syndromes. Only early identification through genetical testing is only possible. There is no treatment for improving the intellectual disability conditions. And the next condition is phenylketonuria. People will call it PKU. PKU, phenylketonuria, it is a metabolic disorder produced by the mutation of genes. The presence of PKU can be detected in newborns by analyzing blood and urine samples. Understood? After birth, child can be tested with urine or blood. They can identify the PKU condition in their body, it is there or not. But if the condition is not identified properly after birth, if they neglect it for more days, the children will become more intellectually disabled. For this also, there is no cure. Permanent cure is not there for this also. For them, they will give a special diet. Doctors will recommend PKU diet. That diet only will improve their condition. Understood? The diet only will improve their PKU conditions. So here also, early screening means the blood test, urine test after birth is very important. Children should not get affected in their later ages with mental retardation. And another condition is Tay-Sachs disease. This is caused by recessive genes. It results in progressive brain damage and eventual death. And this is very critical condition. If children got affected with this condition, most of the children will die before 5 years. This is very critical condition. So we discussed so far about genetical conditions which are creating mental retardation or intellectual disability. Now we will discuss about brain damages. The brain damages also creating intellectual disability conditions. Rubella, there is it is one type of infection, rubella, and syphilis, and herpes simplex, HSV. These three conditions, if children or mother also having, means children will get affected with brain diseases. Anybody heard this, all these things, sir? Rubella, syphilis, and herpes simplex. Anybody heard?
No, sir.
Yes, sir.
Yes, sir.
You heard, sir. No.
Yes, sir, I heard.
Yes,
I heard
normally in
so.
the medical field, people only they can understand all these languages. And these conditions, in your textbook also, they mentioned very clearly, the first trimester of pregnancy, there is a chance of happening all these things. These conditions will damage the brain. Not only this, these are all prenatal conditions. Even during pregnancy time, other chances are there. One more the condition, consanguineous marriages. Consanguineous marriages means the blood-related marriages. It was proved in our society also, we are looking many people, those who married in very near blood relations, their children are getting affected with some disabilities. Have you observed anybody like this?
Yes, sir, I did. Yeah, we did.
Yes, sir. Yes, sir.
Yes, sir.
So,
కొంతమంది అంటారు సార్ అట్లా ఏమో కాదని చెప్తారు సార్ కొంతమంది సైన్స్.
No. There are more chances. See, it is not a compulsory condition. There are more chances.
ఏమో సార్, నేను మా రిలేటివ్స్ ఒక అతను కూడా ఇట్లా అంటారు అని చెప్పేసి, ఆయన సైంటిస్ట్ సార్. అతను ఏం చేసిండంటే ఇట్లా అంటారు అని చెప్పేసి ట్రై చేద్దామని చెప్పి చేసిండు, కానీ అట్లా ఏం కాలేదు సార్.
It is a more chances. I am not saying 100% it will happen. More chances.
Okay.
And marriages getting after 35 years or 40 years, all children will not become intellectually disabled, but there are more chances. Try to understand the difference between more chances and less chances.
Sir, it happens because of chromosomes, right?
Huh? Hello?
అలా కావడానికి గల కారణం ఏంటి అని అడుగుతారు.
Sir, it might happen because of chromosomes, right, sir?
No. Chromosomal abnormalities we discussed, that is genetical. That is genetical. Now we are discussing which are the conditions causing damage. Understood? See, genetically means,
Yes, sir.
Genetically means during conceiving only it is coming. Brain damages means it is happening after conceiving. That means prenatal.
Okay.
And some people will get some VDs, venereal diseases. Syphilis, herpes simplex present a greater risk at later stages of fetal development. Today, we don't have a testing system in our families. When two people are going to get marriage, whether anybody is having venereal diseases, anybody is testing? Nobody is testing.
No, sir.
So,
No, sir.
some people are hiding. In those families, there is a chance of getting brain damage due to venereal diseases. In advanced countries, some people are asking a medical certificate also. We have not come to that advantage stage. So brain damage happening because of the prenatal damages. And other conditions, environmental hazards. What are environmental hazards? In India, it is not there. In abroad conditions, mothers will smoke, mothers will drink. They are addicted for drugs during pregnancy also. So these are all environmental hazards. If mothers consuming alcohol or they are having smoking habits and drug addictors, definitely their prenatal baby will get effect. These are all environmental conditions. But as a psychologist, as a counselor, you have to create some education, awareness among the people. At least they have to take care when they want to conceive. When they want to conceive, they have to plan well in advance. They have to take more precautions because their generations should not get affected with any intellectual disability or some other diseases. This is very much important. We psychologists has to create awareness. It is a role of psychologist, creating awareness. And how to recognize. Okay, now we discussed so far genetical causes and brain damage, environmental hazards. All these conditions we discussed are causing for mental deficiency, mental retardedness. How to identify mental retardation? How to identify? These conditions cannot be identified in prenatal age. Prenatal age only causing, but we can identify only after childbirth only. Normally, a mentally affected children's, when somebody comes to you, when you are taking total case history, we will ask about prenatal conditions also. And during birth process, any problems happen. After birth also, how is the conditions? All these things we will inquire. While inquiring, in case history, we can understand something. These may be the causes. So here also, mental retardation can be identified by developmental screening test only. This can be, have a test. This type of test can be done from 0 to any age. Even after immediately born child also, we can conduct a screening. Normally, a child born in hospitals, the nurses and doctors are screening the immediate conditions. Immediate conditions means whether the child is having cry or not immediately. After birth, the child has cried or not immediately. Within 1 minute, the child has to cry. Then only she can take some air. Some oxygen will flow to the body. So doctors will mention very clearly in the discharge report, the Apgar score. Apgar score indicates there are 5 conditions that will indicate the child is having any problem during birth or not. This is the first indication to identify whether the child will have effect with mental retardation or not. After some age, at least after 6 months, we can screen the child. How is their developmental activity? The child development activity can be observed by screening. Normally, our children will sit at 6 months to 7 month age. They can able to sit on their own. At first birthday, that means 12 months age, they can able to at least stand and small steps they can foot. And even they can utter one word, mummy, daddy. At least 2 years, they can speak some words. These are all the normal developmental milestones. When we compare the children with other children, whether the children is not having this type of developmental conditions, developmental milestones, definitely parents has to get a doubt. They have to take their children for screening. Suppose somebody is sitting at 1 year age only. Normally, child has to sit at 6 to 7 months age. They will try to sit. If the child is unable to sit up to 1 year, that means some delay is there in development. That itself indicates there is some problem in the child. Because of this much awareness, they don't have. Simply they are comparing. My father is behaved like this only. My grandfather was sat at 1 year age. So let us wait. He will automatically sit and stand and walk, everything. But that is not the clear advice we have to give. Let them go for screening, developmental screening. So developmental screening is very important to identify in early age about the mental condition, retardation, or intellectual disability. Okay.
Sir,
Already.
One doubt on this. Because you say that they lose their mother.
Speak little louder.
Sir, few lose their mother, means like while delivering, mother will means like she will pass away. So those children, since they are not getting the mother milk, for them, this kind of delayed thing.
No, it will not happen. Okay. If because of unavailability or milk, people will not become, childs will not become mentally retardation.
This delayed development of sitting or walking.
No, it will not happen. No, it will not happen. Only mental retardation will happen during delivery period. If the baby suffered heavily, the baby more stressed because of more time for delivery period. That time what will happen? The umbilical cord, బొడ్డుతాడు అంటారు కదమ్మా.
Yes.
ఆ బొడ్డుతాడు కనుక ఎక్కువ క్రష్ అయిందంటే see, some deliveries will happen within half an hour. Some deliveries will happen even 6 hours. So during that time, the umbilical cord will get some crushing. Sometimes the umbilical cord wrapped around the neck. So what will happen? The baby is getting everything through that umbilical cord only from mother. Some deficiency may take place. Some oxygen deficiency may take place. Proper oxygen may not passing to the child from mother. If the condition is more time, that means less oxygen passing to the baby. What will happen? The baby brain will get some effect. The affected brain will cause mental retardation. Okay?
Okay.
Okay. The next. How to deal with these conditions? See, the child has born. Already childbirth took place. We identified at 2 years age or 6 years age. But how to improve their condition is another important. As a psychologist, identifying is not only your responsibility. By doing some tests, by observing, you can identify the child is having some intellectual disability. But how to improve the child condition is very, very important. The role of the psychologist is very important in these children's. How to improve social skills we have to teach, some practical skills we have to teach, and self-help things we have to teach. See, the children's identified at severe mental retardation. Assume severe mental retardation children's, most of the time they are dependents. The day-to-day, their functions, the personal functions also, they can't do it. That means taking bath, going to toilet, wearing their own dress, eating their own food. They can't do properly because they are severely affected, severely retarded children. But we can do some improvement for moderately and mildly affected conditions. We can teach them, we can train them also. These two conditions people can be brought to, at least they can attend their own activities. That means they will not dependent for their personal duties on anybody. So here, the profound condition and severe retarding conditions are very critical. There are very less chances their daily conditions will come to normal. Most of the time they are dependent on many activities. But the mild and moderate conditions can be improved by helping by a therapist, by psychologist, by creating some skills training. What are the skills training we can give? Normally, these intellectual deficient children will have some behavior issues. Why behavior issue is coming? They don't understand properly, first thing, what we are saying. So, they will exhibit some behavior issues. When something they are asking, if you don't give, they will become more aggressive. The low levels of intellectual people will have more aggression, more anger they will exhibit. And very mad people, that means the severely affected people, they will behave very rudely. Some people will throw whatever they have in their hand, they will throw on others. They don't know whether it will create any accident or some suffering to other person. That much understanding they are missing. Only the persons, mild and moderate people, they can understand something. So the intellectual disability is very, very problematic. All these things can be prevented during prenatal stage, during birth process, after birth process. These are only the solutions, because there is no medicine for intellectual disability people to improve their intellectuals. There is no medicines. Only through some activities, teaching them to some activities, we can improve their conditions. Suppose a child is getting 57 IQ. By giving better activities, we can bring him to 70 level, IQ levels. But it should be on regular basis only. So this is the thing in behavior modification we can do. And some children will not have speech also properly. They don't pronounce properly the words. For them, we have to show to them at least some speech therapist. They will give some exercises. It also takes a lot of time. There are more chances for improving their language and communication. And education also. Here, the mild intellectual disability people we can educate them. The mild people cannot be identified such easily. Mild people will come to normal stage with a good activities training. If we identify the mild intellectual people in early age, if we train them properly, if we give support them properly, definitely their conditions will come to normal stage. When this will happen? When we identify early. But if we identify in later age, how it is possible? Normally the child development will progress up to 18 to 20 years. But up to 6 years, the brain development will complete by 90%. So, in early age identification, early age activities creating will bring a lot of improvement in children, those who are affecting mental retardation. Okay. Any doubts in mental retardation?
No, sir.
Hello?
No, sir.
Very good. Now the time is 2:30. Our class time is up to what time, Amma?
2:30, sir. It's 3 o'clock.
Only 2:30, huh?
Yes, sir.
3:30. 3 o'clock, sir. 3 o'clock, sir.
So shall we continue another half an hour?
Please, sir. Yes,
Yes,
sir.
sir.
Yes,
Okay.
sir. Go ahead, sir. Go ahead.
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Now we discussed about developmental disorders. First one is autism. Second one, mental retardation. So you got some understanding with our discussion. Now we are going for unit number 11, cardiovascular disorders, hypertension and asthma. Most of the people are having about some knowledge about cardiovascular things. What is cardiovascular diseases? Why these diseases will come? That is first important thing here. See, our state of mind will influence our body. Are you agreeing?
Yes,
Yeah, sir. Agree, sir.
Our state of mind will influence our body. See, in our earlier classes, physical classes also, we discussed about psychosomatic disorders. Somatoform disorders we discussed in earlier classes.
But I partially agree with you, sir. I don't agree with you completely that, the status of mind is your body.
Okay. Explain. Can you explain?
Like say, for example, if you think a healthy body, a healthy mind is a healthy body, in the case of certain scientists, where their body is being completely disabled, but their mind is completely active. I think you know to which scientist I'm referring to, right?
No. See, you talk about Number of people in which area coming. See, mental state means what I am saying. Please give me some time. I will explain you. State of mind means not happy state. Not happy state. Negative state of minds. Negative state of minds will affect our body. Are you agreeing now or not?
Yes, sir. Now I do agree with you.
Yes. See, if everything is good, there is no question of affecting things. Only people, those who are having negative state of mind, negative emotions, will influence your body. That is only causing somatic disorders, psychosomatic disorders. These cardiovascular disorders, sometimes it comes under psychosomatic disorders.
Sir, positive thinking, positive attitude also will influence our body, no, sir?
Yes, it will influence me, it won't affect. It will improve your body conditions.
Yes, yes, sir. Yeah.
Only negative conditions, negative emotions will influence your physical conditions. Here in psycho, see, this chapter belongs to psychophysiological conditions. How your psychological conditions is creating physiological problems. See, somebody is feeling a lot of stress, anxiety, continuously, chronically. It will affect the person's health or not? Is cardiac conditions.
Yes. Yes, sir.
Yes, those things
Yes,
only.
definitely, sir.
Those
Definitely
things
it will
only,
affect.
those things only.
Just as the unhealthy body affects the mind, unhealthy mind will affect the body.
Yes,
surely.
Yes. So, here, you see in page number 111, you see page number 111, you see?
Sir.
The first paragraph you see, psychophysiological disorders.
Yes.
Cardiovascular diseases, hypertension, and asthma. For these three conditions, when the person is undergoing severe stress or anxiety, they don't find any physical reasons in your body. The psychological condition only creating these problems, cardio conditions, hypertension, and asthma. And really, the heart is having some problem. That is different. We are discussing psychophysiological disorders in this chapter. How your psychological conditions affecting your physiological conditions. Okay. First condition is cardiovascular diseases. Cardiovascular disease is a term that refers to more than one disease of circulatory system, including the heart and blood vessels. The cardiovascular diseases related to circulatory of the blood, heart to blood vessels. What will happen when the person is undergoing severe stress? In severe stress conditions, the blood vessels, the blood veins will get constricted. Constricted means, understood? Close. Somewhat it will close. The sufficient blood will not flow. The blood which is flowing is not sufficient to the heart because of constriction. The blood vessels constriction. See, in heart diseases, there are so many types. There are really some problem is there in the blood, in the heart. Creating heart problem is different. when person is undergoing severe psychological problem also, he will get some chest pain. There is no proper reason. Even if you go for a testing, nothing, doctors will say everything is fine. They will advise you, be happy, reduce your stress, take regular diet properly, have good sleep, have good physical exercise. Those things only they will suggest. If they don't find any cause medically, because the person is going under severe stress. That is the reason when we approach a doctor, he will ask about your personal life, what you are doing, what conditions you are having, or any stressful conditions you are having. All these things they will ask. When there is no psychological issues causing problems, there is no need of asking all your lifestyle. They can simply test your heart. Enough, no? Are you agreeing, sir, now? Hello?
Yes, sir.
Yes, sir.
Yes,
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
Yes,
Here,
sir.
in your book, they mentioned some types of cardiovascular diseases. You can read all the conditions, you will understood. See, one thing, we are all not medical doctors. We are psychologists. But we are having some basic knowledge about our body anatomy.
Yes.
That much is enough. Suppose if you go in depth, it will become a sometimes problem also. Unnecessarily, we will give wrong advices also.
Yes.
So, we are specialized in thought.
Yes.
So, there only we have to influence our patients. But this is a job of medical doctor. Medical doctor will take care of all these things. When the patient comes to us, I am feeling more anxiety, I am not getting sleep, I am getting chest pain, I went to doctor, doctor said no problem. In that case, a patient comes to us, we have to find out psychological reasons. We have to make him feel happy by giving some intervention. For that purpose only, we are discussing today this psychophysiological disorders.
Okay.
Clear?
Yes. Yes, sir.
And one more condition. See, in this book also, they mentioned very clearly, you see, the risk factors for cardiovascular diseases. Only two conditions they mentioned, family history, age and sex. Page number 112.
Yes, sir.
After that, what are the risk factors? Why people are getting these cardiovascular problems? One is smoking. Second one is high cholesterol levels, high blood pressure, psychosocial stressors. Psychosocial stressors means emotions.
Yeah.
Emotions like anger, hostility, depression, anxiety. If these people, these are all psychosocial stressors. If the person is undergoing all these anger, hostility, definitely he will have some problem in the heart. Psychosocial factors will influence. When we are so anger, you can see many cases they will admit into hospital because they will get some chest pain. Correct, sir? And coming to what is the role of psychologist here? The psychophysiological problems a person is facing. What is the role of you? Your role is educating the patient. You will ask him.
Others, please be mute. We are not able to understand.
Mr. GK.
Mr. GK.
One second.
Mr. GK, please.
Yeah, right.
Clear, huh? Okay, as a psychologist, you can advise or you can educate the person who is coming to you. There are certain conditions in your book also they mentioned. One is smoking cessation. What will happen if the person smokes also? They written very clearly in your book. healthy eating, stress management, and cognitive behavioral techniques. Stress management, how to manage. There are so many techniques. One technique is, the best technique is JPMR, Jacobson Progressive Muscle Relaxation Technique. We will teach. And cognitive behavioral techniques means a person is thinking most of the time about problems, the unsolved problems. Some problems will not have any reasons also. If going on thinking without any solution, whether that thought process is correct or not, how to change that thought process to bring him to normal functioning, that involve cognitive behavioral techniques. That we call it cognitive behavior therapy, rational emotive behavior therapy, acceptance and commitment therapies, dialectical behavior therapies. These type of therapies, psychologists will use cognitively to change their thought process, and ultimately they change their behaviors. Once they change their behaviors, definitely their health condition will improve. Over, sir. But every student, I request to go through this book and study very clearly each line and try to understand. Our next condition is hypertension. Sir, time is over, 2:43.
We still have time.
Hypertension. What is hypertension? Can anybody explain?
High blood pressure, sir.
Huh?
High blood pressure.
High
BP,
blood pressure,
high
sir.
BP.
High BP.
What is high blood pressure? That is also important. Na? See, through our veins, through our nervous system, our blood is flowing to the heart. See, at what speed the blood is going to heart. Okay. And
Sir,
at
your
what
video-
speed the blood is coming back from the heart.
Sir, your video is off, sir.
Huh?
Your video is off. If
Yes,
you can
I stopped it.
Okay.
So blood vessels becomes narrow.
Yes. Arteries.
Yes.
See, there is everybody seen how they measure blood pressure, systolic and diastolic.
Yes.
There are two readings. Correct, no?
Yes, sir.
But why those two things are showing different readings is very important. We should know. How to address those two things is important as a psychologist. Okay. Here also, there are two factors causing this hypertension problems. One is genetic factors, one is environmental factors. Environmental factors means what? Suppose a person regularly drinking alcohol, smoking daily 10 cigarettes, and the person is more obese. What will happen? His heart cannot pump properly entire body when the body mass index is very high. To entire body blood pumping, heart has to take lot of strain. Definitely the more weight, the obese people, there are more chances of getting high blood pressure. You can read all these things very clearly. They mentioned in your book. Here there is a role of psychologists dealing with hypertension, how to deal. They mentioned very simple reasons. Huh? Hello?
No, sir, she got unmuted. Nothing.
Okay. And losing weight, continuous practice of exercise, healthy diet, cut down sodium, cut down alcohol and tobacco products, manage stress, monitor blood pressure by self. If we have some basic idea about all these things, we can suggest as a therapist. Next, asthma. Asthma is different and COPD is different. Understood? COPD, chronic obstructive pulmonary disease, is different. There is some obstructions. Asthma is a chronic inflammatory disorder of the airways where patients complain of recurrent episodes of wheezing, breathlessness, chest tightness, particularly at night or in the early morning. You have seen many people suffering with asthma in our day-to-day life. Real? Sir, we have seen or not?
Yes, sir.
Yes, sir.
Yes, sir.
Yes. What are the risk factors, asthma?
Yes, sir.
The strongest risk factor for developing asthma are a combination of genetic predisposition with environmental exposure to inhaled substances. See, many people will say, మా ఇంట్లో బూజు కొట్టినాము, బెడ్ షీట్స్ అన్ని దులిపినాము, వాల్స్ అన్ని క్లీన్ చేసినాము. See, I got this suffocation problem because of asthma. Many people will express this type of difficulty.
Dust allergy.
Yes, dust allergy. And other thing, extreme emotional arousal. Suddenly bursting, sudden anger, sudden worries, sudden fears also will cause. These are all the risk factors for getting asthma. Here also, as a psychologist, you can advise what precautions we have to take to avoid asthma problems. I request once again, everybody can read this because in this 1 hour time, we cannot discuss everything detail. You are all master students. Please read everything. Try to understand. If any problem, please call me. I will always available. Definitely I can help you. Whatever knowledge I am having, I will share definitely. And the next class, that means tomorrow, we are going to discuss 12th and 13th units. That means eating disorders, sleeping disorders, and old age problems. These 3 areas, tomorrow class, we will discuss. Okay, sir?
Please share your number, sir.
Huh?
Your contact number?
My contact number is 8978. Hello?
Yes, sir.
8978 000 500. And I think most of the people knows, student knows, we are conducting even internship also for MSc first year students. If anybody interested to join in internship, we will teach many techniques and many procedures, many assessments. You can call me. I will guide you.
Sir, can you tell once again your number?
8978 000 500.
500. Okay, sir. Thank you.
This is Bliss Psychological Services, situated at Kokatpalli Metro Station.
Okay.
Thank you.
సార్ మీ ఒక్కసారి మీ నంబర్ అలా చాట్ అవుట్ ఎవరైనా కావాలంటే కూడా తీసుకుంటారా?
ఏమండి?
చాట్ బాక్స్ లో పెట్టాను ఆల్రెడీ సార్ నంబర్, మెసేజ్ చేశాను నేను చాట్ బాక్స్ లో.
మీకు ఇంకా క్లారిటీ రాలేదా నంబర్ లో?
నేను చాట్ బాక్స్ లో పెట్టాను.
ఎస్ పెట్టారు 8978 000 500. కరెక్ట్
సార్. ఓకే సార్, ఒక్క డౌట్ సార్, మళ్ళీ ఒకటి సార్, ఇది సోషల్ స్ట్రెస్ ట్రిగర్ ఉందని చెప్పండి సార్.
హలో,
సోషల్ స్ట్రెస్ ట్రిగర్.
సోషల్
స్ట్రెస్ ట్రిగర్స్.
No, you call me over phone, sir. I am not clear your voice.
Sir, in Kokatpalli Metro Station, what is that institute, sir?
Bliss Psychological Services. BLISS. Bliss.
Okay.
Psychological Services. You can Google it also. It is coming in Google also.
Okay,
everything
sir.
is there.
Okay.
Or you can call me to this number. I will guide
Okay,
you.
sir. Thank you, sir.
Thank you.
Thank you, sir.
Should have the branches all over
Thank
in
you,
the
sir.
Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Hello, sir.
Thank you, sir.
Hello.
Thank you, sir.
Thank you, sir.
Thank
It was
you,
a very
sir.
good session and your voice was very clear. Thank you so much.
Oh.